on to, I think, what's going to be a fascinating grand rounds by our speaker, Dr. Stephanie Kelley-Romano. Dr. Romano completed her undergraduate degree with a Bachelor of Science in Communication from Emerson College in Boston, and then also received a master's in political communication from Emerson College before she went on to get her PhD in communication from the University of Kansas. And she's been a member of the faculty for a number of years at Bates College, and now is an associate professor and chair of the Department of Rhetoric, Film, and Screen Studies. Dr. Romano is a recognized fantastic teacher. She's got a whole page of teaching awards that she's won. And she has a number of areas of study, but her talk today for us is going to be focusing on conspiracy theories. And she studied a variety of conspiracy theories, I think, ranging from alien abductions to political conspiracies that we've been living over the past number of years. So her talk today for us is going to be on COVID conspiracies, contextualizing and countering false beliefs. Thanks again.
Thank you, Mary. That was such a generous introduction. Before I forget, I also want to thank Jen Jewett for asking me to do this. As I mentioned earlier, it's a different forum than I'm used to, but it's one that I'm really excited to contribute to. Mary's introduction was particularly welcome to my heart because although I'm an associate professor right now, I am standing for promotion this year. And so I've been having a little self-doubt, and that introduction made me feel pretty spiffy about who I am. So I'm going to share my screen with you today, and I am going to tell you, as Mary said, about COVID conspiracies, contextualizing and countering false beliefs. I've prepared about 30 minutes of information for you, but I warn you, like, I teach entire semester-long courses on conspiracy rhetoric, and so this is literally just scratching the surface. And so on my slides, I have included some additional readings, podcasts, and resources for people who do want to continue their conspiracy sleuthing. So during the presentation, I'm not going to be looking at the chat, but instead, I will take questions at the end. And as I said, I only have about 30 minutes worth of information because oftentimes the questions are more interesting than what I have to say. So today, I'm going to tell you what a conspiracy theory actually is, why potentially people believe conspiracies, and how we can counter these false beliefs. So we will get right to it. Oh, look, I can actually work my slides. All right, so who am I? We've already heard some of this, so I will blast right through it. I'm an associate professor in rhetoric, film, and screen studies at Bates College. I've been there since 1999. I got my PhD, Rock Chalk Jayhawk, from the University of Kansas. And as Mary alluded to, I also study alien abduction experiences, political rhetoric, and also feminist television criticism. So I obviously study a broad variety of things, and I study them from a rhetorical perspective. And that's what I'm going to talk to you today about, a rhetorical perspective. And what that basically means is rhetoric is the study of persuasion. So my education is grounded in that classical Western tradition of Aristotle and Plato. And it was Plato who wrote about the fact that the doctor may have the right remedy, but if they do not have the appropriate means of communication, they may be unable to convince the patient to take the treatment. So while I have no medical knowledge, I do have an intimate knowledge of how rhetoric works and how to be persuasive, which is information that can be useful to you all. So we're going to start. I'm going into full-on teacher mode here. We're going to start with what is rhetoric. And when we talk about rhetoric, as I've already alluded to, we're talking about communication and persuasion, but we're also talking about the creation of truth, what we believe. And we do this through both forms, and symbols. And so when we think about forms, think about political speeches, think about television shows, think about even internet memes. All of these things are forms that create arguments, forms that can carry messages. And they do that through symbols. And so when we think about symbols, we obviously think about language, which is the most pervasive symbol system, but also about images and about nonverbal communication. All of these things impact communication and can impact what we think is real. So when I'm considering these forms and symbols, I also consider the role of authority and expertise and the broader cultural context that potentially inhibits or encourages the acceptance of particular sources or particular explanations in the creation of truth, or more accurately, the struggle over truth. So right now, I'm just going to use the anti-vaccination movement as an example, because there we have a public discursive space that is still contested, despite overwhelming medical knowledge and agreement about the safety of vaccines. So what exactly is going on there? Why do these false beliefs persist, and why do these conspiracy theories emerge? In order to understand what's going on there, I'm going to tell you briefly about 3 different types of information. The most basic type of problematic information is misinformation. And misinformation happens just when we mishear things, right? We misunderstand them, or we otherwise garble this truth on the way to understanding something. So for example, I might see a study on my cousin's Facebook page that connects vaccines and autism, and I might believe it because I trust my cousin. So I have misinformation, right? I believe something that is not true. Now, the second type of information that's relevant for us here today is disinformation. And with disinformation, misinformation is deliberately conveyed as true for some usually political gain. And so misinformation is basically, disinformation, excuse me, is misinformation strategically deployed. Joe Kennedy and Jenny McCarthy might constantly retweet negative experiences with vaccines to their followers in order to convince people to vote against mandatory vaccines in public schools. Now, even here, in this example, we're still not at the level of what I would call a conspiracy. It's deliberately manipulative, it's misuse of evidence, it is faulty in terms of reasoning, but it's still not a conspiracy, at least not in my book. For a conspiracy theory, there needs to be a motive. There needs to be some sort of evil. And Richard Hofstadter writes about the paranoid style in American politics, and Earl Krebs writes about conspiracy rhetoric as a genre, and it is he who adopts the word evil. And I put it in scare quotes, but there absolutely needs to be some sort of nefarious reason for the happenings of history within conspiracy. So in our autism example, when the narrative changes to one where Andrew Wakefield, the former doctor whose research on autism was shown to be fraudulent and discredited, when he is said to be deliberately discredited in order to silence the anti-vaccination movement so that the government will be able to control people through vaccines, then we get to this level of conspiracy theory. So a conspiracy theory, there it is. A conspiracy theory is a belief that there is a secret plan by a group to do something unlawful or harmful. Now, obviously, sometimes conspiracies are true. And so that's really, obviously there's a lot of oversimplification going on here today, but conspiracies oftentimes are those things that might be true. Conspiracy theories are those beliefs that are potentially damaging and harmful to the public sphere and also without evidence. And so we're concerned primarily with conspiracy theories today. So for me, there has to be that evil at the center of the narrative in order for me to call it a conspiracy. And in my work, I unpack conspiracy theories in order to understand the fear that holds them together, right? What are conspiracy theories a response to? Why do certain people believe them? Why are some of them more popular at some times than others? I mean, these are all the questions that I try to understand and that I find super fascinating. So, excuse me, understanding how and why particular narratives work in particular historical times is exactly the work of the rhetorician, right? This is what I do. It's this cultural detectiving. And that's why I love what I do, because I'm basically a rhetorical detective. I find it incredibly fascinating. And when we do this, the first approach and kind of the gross approach that we do has to do with something called the rhetorical situation. And when we consider the rhetorical situation, the entirety of what influences rhetoric, communication, and truth, when we consider that, we consider the exigence, the audience, and the constraints when trying to understand it. And so today I'm going to talk about each of those in respect to coronavirus conspiracy theories. So considering the exigence encourages us to think about what conditions call the rhetoric into being. And I can start with a little bit of a spoiler in terms of the actual social scientific research. Joe Uzinski and Joe Parent have found that the level of conspiracy belief remains fairly constant over time. So even though it may seem as though we are in an age of conspiracy, and it very well may be that we're hearing more about conspiracy, the number of people who actually believe conspiracies remains about the same. Now, that said, this research was published in 2014. So it's pre-Trump and pre-COVID. And I am not sure exactly what the long-term consequences of having a conspiracy advocate in the White House in President Trump is going to, what those consequences are going to be. And anecdotally, I can tell you that I feel like this moment is heavy with conspiracy. But I also know that I could very well be mistaken, and I'm looking for conspiracy. So although that position is still, I'm still a little waffly on, I can say with confidence that conspiracy theories don't ebb and flow as dramatically as we may think, right? We don't need to panic. The degree to which people believe in conspiracies isn't as huge and hyperbolic as the media may suggest. We also know, when considering the exigence, that there are certain conditions that make people more likely to believe conspiracies. So we know that in times of uncertainty, conspiracy beliefs rise. People want explanations. Of course, we want to feel secure. We know that in times, especially of economic destabilization, we have increased belief in conspiracy theories. Basically, when we have situations for which there are not simple answers, when things in the world feel big, when they seem big, we want big explanations. Likewise, when things have a perceived risk, the likelihood that we are going to grab on to a conspiracy explanation is more likely. So, global pandemic, unknowable risk, economic instability, lack of simple, easy answers. I mean, check, 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 right? We are in this perfect storm of cultural, historical, and psychological exigencies that are conducive to conspiracy theorizing. So the exigence we can begin to understand. We're in a scary time, and we've all been isolated and put at home. And so what are we going to do? I don't know about you all, but I Google it, right? And so I am going to try to soothe myself, and I'm going to try to find knowledge, because knowledge provides security and comfort. And unfortunately, this is where things get complicated. There are a variety of constraints, right? And constraints are those things that influence the type and quality of information that we receive. Constraints can limit what it is that we can hear. And those things can be actual events in the world, or they can be individual or societal biases and attitudes. All of these things constrain and tint what we can hear. So one of the biggest constraints regarding conspiracy theories and conspiracy belief is, I argue, the dissolution of the fairness doctrine of the FCC, the Federal Communications Commission. And basically, in 1941, this doctrine was adopted in order to ensure that all holders of broadcast licenses, radio, and increasingly television, would present controversial issues in a way that was honest, equitable, and balanced. Now, this isn't the equal time rule that came about later for political candidates, but it was a rule that was designed similarly to ensure that people were exposed to a variety of viewpoints. And it also required that those people who were being talked about be allowed to respond, which, hearkening back to our ancient Greeks, right? That was a precept used in ancient Greece by the Greeks when they were trying to discern what would be most helpful to democracy. Being able to confront your accuser was one of the major principles that they embraced. So we adopt this fairness doctrine in order to present information to the public in a way that is fair, and maybe not objective, but at least more complete. So then in 1987, which is not that long ago at all, this policy is eliminated, right? And in practical terms, what that means is that news reporting could now basically be positioned for maximum readership and viewership, right? Broadcasts no longer had to be honest, equitable, or fair. And this only has to do with broadcasting. So again, it's a little more complicated than this, but for today, this is fine. Meanwhile, and also kind of simultaneous to that, we have the expansion of the internet. So as a medium of communication, obviously the internet is huge. The degree to which it has revolutionized what we can know, the way that we work, and even the way that we think cannot be underestimated at all. And so as the constraints on information around fairness were being removed, our access to information exploded. And I argue that our individual ability to assess and weigh information did not necessarily keep up. So the thing is that we all have misperceptions, right? We all believe some sort of disinformation, and many conspiracy researchers note that most of us believe at least one conspiracy theory. So why exactly is that? I grew up watching Chet Curtis and Natalie Jacobson on the nightly news down in Boston, right? I had expectations about objectivity, about evidence, and about journalistic integrity. Same thing when reading the local newspaper or even a regional newspaper like the Boston Globe. And what happened was, and why Rhetoric is so amazing, is that I was conditioned to read the cues of the form. Remember our speech, our television show, our meme? Well, form is super important. And Kenneth Burke writes that form, I love this, is the creation and satisfaction of an appetite, right? Form is the creation and satisfaction of an appetite. And so what that means is that as a viewer, I have expectations. I have what things that I believe are going to happen. So when something had a masthead and columns and headlines, I would read it as news. Similarly, if someone was sitting at a desk and had a little picture behind them and were reading news, I might listen more uncritically because I knew that there were rules in place that they had to follow in terms of what they could present. Now, since the revoking of the fairness doctrine, on the internet, these same forms, right, the way that they look, can be adopted by virtually anyone for any reason, and there are no rules. So additionally, what happens is that people are primed to read these certain cues as legitimate because we have faith in the form. So we've all seen sources that are not reputable that present themselves as like legitimate by using these visual cues. So although they adopt the form, they might not be news, and they certainly might not be true. So the form of conspiracy rhetoric is super important, and is something that I'm going to tell you a little bit more specifically about. And overall, the form of conspiracy rhetoric is read through a rational world paradigm. And what that means is that it's read through the lens of logical argument. So it feels logical and rational because it uses strategies that mimic actual rational, valid rational argument. So it uses evidence dumping. It will give you tons of information and cite lots of sources, but those sources are faulty. It follows the valid process of claim, data, and warrant, but invariably within that contains fallacies of reasoning, Oftentimes, the data supplied does not support the claim if you look closely, or it includes faulty evidence. Now, this is super important and also ironic because valid, normal, rational argument does not work with countering actual conspiracy theory believers. Research actually shows that if you include refutative evidence in an article about conspiracy, for those people who already believe the conspiracy, their beliefs will actually be reinforced. So we saw this when journalists tried to refute the disinformation or budding conspiracy theories that the coronavirus was created in a lab in China. And for those who were already leaning in to the conspiracy theories, their response to this was, of course, the news media is going to deny this. They are trying to make President Trump look bad so he loses the election. And so then in that way, they would double down on the belief. Right. And that's the mental magic that happens in conspiracy thinking. It is this warping of critical thinking skills that then become impervious to rational argument. And as anyone who has dealt firsthand with someone who believes a conspiracy theory knows, providing counter evidence prompts those people to dig their heels in further. So that example that I just used is also an example of another strategy called webbing, or connecting various pieces of disinformation and conspiracy elements into a vast conspiracy theory. So in conspiracy theories, everything is interpreted in light of the conspiracy. And that's why the motive is so important to understand, because it gets to the root cause of the fear. Another example of this webbing is the notion that 5G spread the coronavirus, right? And the way the logic for this goes is that because 5G was expanding as the coronavirus was starting to surge, then suddenly they must be related. And obviously, this is associative false logic. It assumes a false cause. It's connecting things that aren't necessarily related. So it is a fiesta of fallacies, but this is the conceptual slippage that happens in conspiracy rhetoric. Similarly, and the next strategy is called equivocation. And equivocation is when similar things are replaced incorrectly. So the easiest example that I always cite when I talk about this is with Obama's birth certificate, right? And there was a certificate of live birth and there was the birth certificate. And Donald Trump would oftentimes invoke the fact that Obama hadn't presented his birth certificate. He had only presented a certificate of live birth. This equivocation to using two similar things in different ways for political gain was going on. There's another example potentially in a recent tussle between Rand Paul and Tony Fauci, when Paul claimed that Fauci's wearing of a mask was only theater, right? And so during the exchange, Fauci was talking about that much was still unknown, right? We didn't know about different variants. We didn't know about a lot of things. And so wearing a mask is actually still necessary. And Paul tries to flip it by replacing unknown with conjecture, claiming that Fauci was wearing his mask based on conjecture. Now, this kind of verbal slippage, this substitution, this equivocation, in this example, conjecture has a much more pejorative connotation than does unknown. And it also kind of gives Fauci agency in this kind of manipulative, almost sinister way. And so looking at the specific language used and how the differences might be relevant is important to understanding conspiracies. Conspiracy theories are also self-sealing. And basically what that means is that they create their own verification. They are a closed system, which is never good for debate or advancement of knowledge, right? So within conspiracies, lack of proof of the conspiracy is actually read as evidence of the conspiracy's efficacy, or the power of the conspiracy is actually evidenced through lack of proof, right? This is the way these work. So in the case of coronavirus conspiracies as a plot to thwart Trump's reelection, Trump himself would say that they, meaning all mainstream news sources, were in on it, right? Exaggerating symptoms, inflating the number of deaths, obscuring causes, and also hiding cures. In this case, Trump constructed the conspiracy as so powerful, it could literally do everything, that it was creating everything that people possibly knew. And so in this way, it's self-sealing. If there's no evidence of a conspiracy, right? If people confront conspiracy believers and say, okay, well, what's your evidence? They can come back with, well, obviously the conspiracy, the opposition, the cabal is so all powerful that they are able to hide everything and or silence everyone who might possibly speak out against the conspiracy. So in that way, they're self-sealing. So these exigencies, we're going to go back here. These exigencies and constraints work together in order to make conspiracy theories more viable for people, right? Both our psychological states and also kind of the forms of conspiracy theories work well together to make these possible. But what people, right? And so audience is the third factor when we consider the rhetorical situation. And audience is important because as we move forward to think about how to counter faulty thinking, we need to be cognizant of the actual audience. Because as I mentioned before, most people aren't necessarily diehard conspiracy theory believers, but most of us believe at least one conspiracy or at least believe some form of mis or disinformation. It's important to know the difference because different rhetorical strategies to countering faulty thinking work on different types of people. So for example, ridicule is something I'm actually not a huge fan of, but it's actually a rhetorical strategy that works to counter misinformation well. So for people who are not yet fully committed to an attribution of motive, who haven't really dug into the belief, ridicule, think Saturday Night Live or John Oliver, can actually work to dissuade them of potentially false beliefs. So if I believe that vaccines might cause autism, or I'm waffling on that, but then I see John Oliver talk about Jenny McCarthy and her anti-vax perspective and refute it, that might be enough to move me away from that belief, or at least cause me to question that belief. So if we know in terms of audience that most people are not full-blown conspiracy zealots or conspiracy advocates, but oftentimes simply victims of mis or disinformation, what does this mean? What can we do? According to the COVID-19 symptom survey at Carnegie Mellon, trust in local healthcare workers among vaccine hesitant adults has increased significantly in January and February, even though trust in other information outlets has remained unchanged or decreased. And so this to me is good news, right? What this says to me is that health professionals are in a very privileged position to exert influence. But then, of course, the question is, how do we do that? What do we do? And I have some ideas, but obviously it's more complicated than just this. But first of all, pre-bunking. Research shows that pre-bunking is incredibly effective. So not surprisingly, being ahead of the curve allows people to rewrite the narrative and to determine what are going to be the evaluative criteria when looking at particular experiences or instances. When people have less information, they're way more easily persuaded. So to provide information that people might feel fear around preemptively can be super helpful. Also, affirming processes can also be effective in that it simply reassures people and comforts them to know that what is happening is to be expected. So currently what I'm reading is that there's a source of vaccine reluctance around the uncertainty about the speed at which the vaccines have been tested and approved. To simply provide information about the approval process then could simply reassure people who might be fearful. But again, and I probably should have given this talk like 6 months ago, this type of information is much more effective when offered earlier rather than later, right? Rather than as a reaction. If offered as a reaction, it could potentially have that counter-affirming impact of committing people further to wrong information or to a conspiracy belief. Another rationale for vaccine hesitancy that's going on is concern about the adverse effects. So similarly, addressing concerns about potential or perceived effects could help people feel more confident, right? to dismiss nothing because fear is nothing if not irrational sometimes. And that relates to the second thing. We need to recognize that people are oftentimes, rightly or wrongly, emotionally connected to their beliefs. Last fall, I was on NPR because wearing a mask became, for some people, a sign of disloyalty to President Trump. And so increasingly, things are politicized and polarized. And often, unfortunately, what this means is that people listen to respond and not to hear. It sounds hokey and it's kind of basic, but it's also totally true. Because to be wrong right now in this cultural moment is threatening. And then if you sprinkle in kind of a fear of cancel culture, and is it any wonder that people are defensive and afraid to be wrong or afraid to say what they think? So what we can do is be empathetic, right? Building trust and building that relationship is much more important than convincing someone in one interaction. And research shows that most people who move away from conspiracy beliefs do so because of interactions with someone they trust. They're not going to read an article in the Atlantic or in the Wall Street Journal and suddenly change their mind, right? They're going to change their mind because of Aunt Betty or because of us. So to be empathetic, we can certainly find points of agreement. And then rather than tell, ask. And this can be hard. And I know this is super hard for me, right? Because I go into teacher mode. I'm a teacher mode. If you come to me with a false belief, I want to give you charts and graphs and counter information and sources and how to evaluate those sources. And I want to tell you why what you're thinking is inaccurate. But this approach, research seems to indicate, is exactly wrong. Instead, we need to ask people why they believe their false belief or where they get their information. And then we need to empathize and acknowledge that the sheer volume of information that they need to sift through is significant. And then potentially offer them things like media literacy web pages or a list of reputable sources to seek information from. And I think many people would use this information, I'm behind on this, would use this information if it were given to them, particularly given to them by people that they trust. Third, we need to amplify sources and voices that are reputable, right? In the first few months of the pandemic, conspiracy and disinformation related websites were being created and shared at breakneck speed and numbers. It was ridiculous. Meanwhile, the CDC and the World Health Organization sites received many, many, many fewer hits. Very, very low traffic there. So to amplify reputable sources is key, and it's also easy to simply retweet these links, to post them on social media pages of either individuals or practices is a way to get that information out there, to give people something to click on. Because when people are fearful, they want to see information, they want to read something. And if the positive, reputable information is not out there, they are invariably going to be taken in by the clickbait and by the bots. So fourth, we need to encourage critical thinking skills, right? Research shows that when people who believe conspiracy theories are reminded of their attachment to critical thinking and to rational argument, they sometimes take those skills and turn them on the conspiracy theory itself, right? And obviously, any self-persuasion that goes on is going to be way more effective than me trying to convince someone if they can convince themselves. So critical thinking, again, can be promoted through the sharing of media literacy materials via social media, and many of these things already exist. When we first were told to stay at home, like I had to go through very basic things with my mother and my aunts, right? That like when you Google things, mom, the first couple of responses that you get are going to be ads. They're going to be paid to be there. And so you need to scroll down and you need to look at the URLs. I had to tell her that Google uses cookies, which means that future searches are based on prior clicks. And as you can imagine, based on my research areas and my prior clicks, my Google searches are oftentimes very strange. But I have to consider that because we are increasingly living in these echo chambers that have virtually the opposite effect of what the fairness doctrine's idea of exposure to alternative ideas intended. Relatedly, we can teach people what to look for in reputable news sources, and doing that is important. And again, able to be done through retweeting or posting things, posting sources and web pages that already exist to do this, and simply call attention to them and create new wells and new sources for people to go to when they want information, when they feel afraid. And these pages note several things that, again, are kind of basic, right? Like, if you have an emotional reaction to a headline, that's probably not an objective piece of news. If the article uses a lot of rhetorical questions as opposed to evidence, that might not be what you want to believe. And if pop-up ads all of a sudden start assaulting you when you open a newspaper, this could be a warning sign that this site may not be fair or balanced or what you want to be looking for. So these are just a couple of the basic ideas that I think most people, including me, can use reminders of, and that some people just need to be basically introduced to. But they're at least a beginning, because what most of us who research conspiracy theories can agree on is that disinformation does not gain traction among people with scientific and media literacy. The problem is that as humans, we tend very much to not be aware of our blind spots, and we often overestimate our knowledge. And so my motto when approaching conspiracy theories is constant vigilance, right? Use every interaction as an opportunity to learn first and foremost, but then also hopefully to teach. So that is, oh, and then I have these little resources that I'll share with you, but that is what I've prepared, and I'm more than happy to take questions. Okay, let me see how I do this. Welcome to Grand Rounds.
You're able to see the chat box, right?
I am. I'm looking
How
now.
would you like me to read you the questions, or?
No, I can read them. I just figured
Okay.
out how, so I'm just going to take a little sip of water.
Well, I can start with one because there's some before it. So,
Okay.
so one comment from Dr. Hayes is, can you comment on the risk of ridicule as a tool and the problem with not calling out lies when presented in public speech or debate?
Right. This is, thank you, Dr. Hayes. This is a great question, because I mean, the research is somewhat conflicting on this. And I think, again, this is why we have to consider the entirety of the rhetorical situation, because there are situations where calling out false evidence is actually very persuasive and very necessary to the public sphere and to kind of healthy democracy. And I think maybe an example of this we saw during the 2016 presidential election. So when then candidate Trump was making claims, oftentimes claims that were not based in evidence or that were totally without merit, at first the news media didn't really seem to have a way to deal with that. And instead, he was getting all kinds of replaying because of the hyperbolic nature of his discourse and persona. But what we saw happen is the chyrons, which are the lower third ticking the words that go on, the chyrons were quickly employed in order to say, you know, allegedly Donald Trump alleges, or although it is unsupported, Trump claims. And so we began to see the news media calling out those types of missteps. Likewise, now a lot of social media organizations, Facebook and Twitter, at least both, have certain measures in place so that if you try to share something that might be from a fake news site, it will prompt you to go to a site that is actually more legitimate or that has been verified. Likewise, if you try to share something without reading it, I think it's Twitter will say to you, are you sure you want to share this without reading? Which is a little bit of shaming. So I do think that different situations, different speakers, different environments, all of these things require different rhetorical strategies in terms of ridicule or calling out and things like that. And obviously it's super confusing, but I hope that answers it somewhat, or at least begins to. Okay, I see Jen Jewell has a question. Why should we engage in social media when there's so much disinformation on the sites? Can you tell the reason you think that autism vaccine debate arose? Sure. So first of all, I think that we need to engage in social media because it is potentially a low stakes, low involvement way to get a different perspective out there and to kind of literally flood the market. And as I mentioned, a lot of social media does have disinformation, and those sites are starting to catch up in terms of their own policies for trying to control false information. But what needs to happen is there need to be as many outlets and as many links, as many clicks to positive, healthy, helpful information as there are to disinformation and fake news. Furthermore, simply engaging with actual news sources that have been verified and simply familiarizing yourself with what makes these things good news sources makes people more able to discount fake news in the future, right? They become just more adept at social media. And the second part of the question, I love this question. I didn't know how I was going to put it in my presentation, so I'm grateful that you asked it. The reason that I think that the autism vaccine debate arose is and this is obviously only a very small part of it, but originally regarding autism, I do a lot of research on motherhood and women in a variety of different contexts. But one of the things that used to happen with autism was that refrigerator moms were blamed for causing autism, right? Like mothers were blamed for, making people gay and or for causing autism in their children. And specifically, it was refrigerator moms, these moms who were cold and who weren't necessarily nurturing in the ways that traditional womanhood and femininity dictated that they should. And so what happened, and this also corresponded when people were starting to go to work, women were going to work, children were going into daycares. We have the whole satanic ritual abuse, misperceptions and thoughts that happened around the panic that happened around that, which were entirely baseless. And I argue that all of those things were basically a reaction to women working and to women violating traditional gender and particularly expectations of what a good mother is. And so I argue in some of the work that I do on the autism vaccine stuff is that when people like Jenny McCarthy came forward and offered, this link between autism and vaccines, mothers who were, tired of being blamed for it, grabbed onto that answer. It's like, yeah, look, it's this vaccine. It's not me. And then what also happened concurrently was women would get this extra legitimacy, like motherly intuition became a valid form of knowledge, right? So I know my child. And that's not to discount that we don't know our own bodies or that mothers don't understand their children in ways that are intimate and valid. But in ways that are oftentimes what would happen is it was in ways that were exclusionary. So I could talk about that all day, but there are a lot of questions. So I'm going to leave that one there and hopefully that's okay. How do you recommend discussing this issue? This is from Megan Wells. How do you recommend discussing this issue with someone who you supervise? And this is a really good question. I have a staff member who's starting to consider the vaccine, but originally felt it was a conspiracy to thwart Trump. Right. There's a power dynamic as I am this person's manager. I absolutely hear that. And I grapple with this somewhat as a professor, right? Because part of me wants to simply, indoctrinate my students and tell them exactly what and how they should think. But I also believe that that is brutally unethical. And so I don't do that. And instead, what I do is I provide the tools, right? We provide the tools for people to come to their own conclusions and respect, hopefully, the humanity and individuality of every person to come to their own decisions. What I want to do is I want to give people the best ability to make the best decision. And so, as I mentioned in my presentation, oftentimes when we remind people of their own commitment to rational argument and to critical thought, what happens is they might then on their own, right? Because this is a face-saving proposition too, right? People aren't going to just be like, oh yeah, you're right, I'm wrong. We're not really that kind of culture. But on their own, they might kind of rethink what it is that they've been thinking. And I think another thing that people can do, particularly people in power, is they can admit that they're wrong. So when I can go into my students and say, oh, hey, listen, when we were talking about this, I said this, and, you know, I was absolutely brutally underinformed. And after more research, here's what I'm kind of thinking now, and recognize kind of the generative, cumulative, progressive nature of knowledge, then it makes other people doing that less threatening, right? Because interpersonal rhetoric and interpersonal communication shows us that when I am willing to be vulnerable and to be wrong, then it makes other people much more likely to approach me when they feel as though that they need to be vulnerable or they need to be wrong. So yeah, so I hope that answers your question. All right, Carol Hubbard there are a lot of questions, so I'm kind of whipping. So Carol Hubbard says, how does educational level of the audience play a role in believing conspiracy theories? Is there research on this? I apologize if you did address this and I missed it. You totally did not miss it. I totally did not address it. And yeah, there is research on this, and it shows that people, it's interesting. And what's really interesting is that conspiracy theories have a tendency to be somewhat different than misinformation or disinformation, false beliefs, and fake news. So when you get, you know, hip deep in that stuff, it really gets murky. But generally, I can say, and this is broad brushstrokes, generally, people with more education are less likely to believe conspiracy theories. Also, and I'm trying to remember, I haven't brushed up on this literature in the last week. So if I misspeak, I'll certainly try to reclaim the truth. But I also think that while older Americans are likely to believe conspiracies, which was something I anticipated, right? Because my mother, but also younger Americans, 18 to 25, they are more likely to believe conspiracy theories. And this is also something I'm glad that got brought up, because I wanted to talk about it in the sense that that age group gets their information and gets their news from so many different sources. They get it from TikTok. So I have a TikTok. I don't understand TikTok. I have TikTok, Instagram, Snapchat. I have all of these things in an attempt to understand the confluence of information and authority and sources, right? And with TikTok and with Instagram, oftentimes there are influencers, there are literal influencers. And so I argue, and what I'm trying to do in my work is get these influencers, even if they're not rhetorically savvy, I am, is to get them to advocate or to advance these more reliable news sources and to fight fake news. And so in my classes, my students have made, we did a bunch of stuff last semester in presidential campaign rhetoric about the election in Georgia, about the runoff elections in Georgia, and specifically trying to counter disinformation and misinformation. And what they did, I just wanted them to kind of think about misinformation and disinformation, but students they just do so much better than what I expect of them. And what they ended up doing was they made TikTok videos and Instagram posts that looked amazingly professional and awesome, that led people to actual, positive and viable sources for information about these topics. And so, yeah, there is an educational level associated with it. There are also, there are arguments about certain conspiracy theories, in particular political bent, but what much conspiracy rhetoric shows is that people, regardless of political affiliation, can believe conspiracies. They're susceptible to them. Okay, so here's one from, Jen again, Dr. Jewel. Do people know if they are involved in disinformation and or conspiracies, right? Or are folks unaware that they're subject to disinformation or conspiracies? This is the thing. And I draw heavily on my research with alien abduction experiencers when I think about it from this perspective, because just like we don't know what we don't know until we know it, I do not believe that many people understand that they are not understanding things correctly or falling victim to false beliefs or to conspiracies. So no, I don't think we do know. Just like I think that right now, in all likelihood, I have some beliefs that are false. I have believed some misinformation, some disinformation, and potentially even some conspiracy theories. And so again, it goes back to that point of like constant vigilance. I have to constantly be thinking about what is it I think I know, and simply I think the best foil, not the best. I use superlatives far too much, but one of the best foils to it is to simply remain open, right? To remain teachable, to not dig in and believe that I think I know anything. So I know that my experience and expertise both position me to have knowledge about how we create knowledge, how people believe things, and what people believe in a way that is useful to a lot of people. It certainly doesn't mean that I have the market on that or that I know everything and that there aren't other fields that can contribute usefully to that. So I'm just always a fan of humility and compassion when trying to communicate as a polis, right, as a community. So no, I don't think that people are, but nor do I think that somehow the people who are involved in conspiracies or subject to disinformation, I don't think that they're a they, right? Because I think that what that does is it kind of puts us in this place of privilege that I think causes at least me to then not question my own beliefs and not be self-reflexive and recognize that I too can fall victim to these things. Not because I'm not smart or I'm not a good person, but just because I'm human and we're emotional and sometimes we react, and all of those things can point us towards conspiracies. Okay. So I've always assumed that talk radio hosts have all the advantages in terms of making opposing callers look stupid. Thus, I've never called in with my opposing view. What? Okay. Yes, Logan. I don't know. Oh, there it is. Sorry. What's your opinion about calling into shows that present misinformation like Grace Curley or Howie Cobb? Right. Yeah, this is a good question. In terms of actual talk radio and in terms of sources that I consider to be kind of disinformation or echo chambers, those that are really invested in their particular perspective, those shows, like I mentioned earlier, they're listening to respond, they're not listening to hear. And unfortunately, I think that's like barking up a tree. I don't know if that's the expression. I think that that's like not useful. I don't think we're going to convince anyone there. I don't think that people are going to suddenly change their mind, that Howie Carr is going to suddenly be like, oh yeah, you're right. No. But so what I do think is that the efforts are better spent creating spaces for those people who are uncertain, all right, who haven't necessarily leaned all the way into the conspiracy theory, who aren't, vehement zealots, to kind of try to keep that moderation space of open debate and to make that space bigger. And then I do think that there are times, Ann Coulter, I'm not remembering this correctly, but Ann Coulter, for example, Ann Coulter, evidently, when she goes places, her talk, which she's usually given like an hour, her talk is actually only like 12 minutes, but she builds in time for people to heckle and for people to kind of have opposition, etc. And so evidently somewhere, I don't remember where, but somewhere what they did as a method of resistance was they simply sat there and they simply let her say what it was that she was going to say. They didn't react. And so in not reacting, she was done in 12 minutes. It totally took the air out of the situation, out of the balloon, if you will, and really kind of countered it in a more effective way. So I think that people who study countering false beliefs, misinformation, or kind of dangerous beliefs, I think those people are thinking more and more broadly about a variety of strategies that we can use in different situations. Colby says, thank you. Thank you very much, Colby Wyatt. Amanda, some of my hesitancy with social media has been hearing about the stalking, death threats to other physicians, such as Paul Offit, who have been more public in countering vaccine information, or Lyme researchers who need security at their labs to being targeted, right? Any suggestions for minimizing them being targeted? Yeah, I mean, obviously, it's horrific. It is horrific. And I do think that there are ways to at least kind of put our toe in the water in innocuous and seemingly less threatening ways. So I think that we can counter beliefs in a variety of ways, right? We can actually confront false beliefs and be vehement about their inaccuracy and give the evidence to the contrary. But we can also then simply present alternative perspectives or present sources or present tools so that people can then think for themselves. I mean, that's the whole metaphor about, right? Teach someone how to fish rather than give them a fish. So if we teach people how to evaluate sources, how to be aware of these bullying, of these kind of usually economically gained, right? Like Alex Jones, his whole thing is he's selling supplements that are going to help all of the conspiracy and bug out bags and things like this. So to help people recognize the economic gains or the motives of people who are advancing these conspiracies can sometimes be helpful. But that is certainly a tough question. Colby Wyatt says, you may have answered this in regarding supervisors and skeptics, but are there any tools that you feel institutions like hospitals and school systems can use to counter conspiracies and disinformation leading their employees to refuse the vaccine? Yeah, I mean, again, I think it's just that kind of provide general information about how to think, provide a variety of sources. And then we do have to kind of trust people to a certain extent. And I do trust people, because what I have found, and I've seen this in my classes, which is just so heartening, is that I have students who will come to me with absolute false beliefs and they are fearful. Like, I understand the psychological motivation behind such beliefs, particularly considering this moment. And they come to me with these false beliefs around particular issues. And rather than tell them that they're wrong, I just simply suggest sources. And usually they're the sources, and I think I've provided some of them in my slides. They're just how to think, or what are the dangers of misinformation, or what is fake news. And after people have kind of gotten up to speed with that stuff, they're a lot better at parsing out true versus false information. Okay, so again, Stephen Hayes, John G. Can you discuss the role of knowing entity person in the evolution of conspiracy theories and their role in challenging conspiracy, such as freezing Twitter accounts, critical journalism, etc.? I'm not quite sure that I understand that correctly, but I can, when those words are said to me, what I think is that shutting those things down is sometimes a good idea, particularly if they are spreading disinformation or dangerous information. But of course, that is a slippery slope. And I also am a proponent of free speech, and I want all perspectives to be able to be present. But I want people to have the critical skills to be able to make up their own minds. We're just at 2 minutes too. So Carol, I don't know if I should stop.
No, I think you keep going.
Keep going. Okay, here I go. Sorry for the confusion. Yes, the text number was right on my little screen too. Are you aware of any changes to early high school education to help boost teaching around and evaluating sources? I'm not, but I'm also not privy to that, other than I have a first year in college and a sophomore in high school, but they are very typical teenagers, and they will not talk to me about this. Even when talking about conspiracy rhetoric or fake news or Aristotle and the modes of proof, my children will not take my advice. They do not think I understand what I'm talking about. So in a way that might brutally undermine my credibility here as I wrap up, but I don't know of any actual systemic changes to education. But I do know, and I think, like I talked about when I talked about the different constraints that kind of happened all at the same time, I do think that our lack of media literacy and also our lack of scientific literacy are both really hurting our ability to evaluate information. And I think that scientific literacy has to be something that is put forefront. Like, people need to be able to read a journal article, and even if They don't do statistics. I don't do quantitative analyses. I can read those statistics. I understand what they mean. Okay, I read an article this AM about conspiracy beliefs prevalent amongst refugees in the Portland area, such as that COVID vaccine implants a tracker, yep, that will damage your chances of citizenship, or that the vaccine is more damaging to Black people. Absolutely. How can we address these myths, especially when coming from a different cultural and racial group? This is absolutely true. And the stuff that I've been reading lately says that women, Black Americans, and people with pre-existing conditions or people with those conditions that might be affected by a vaccine are the ones who are most vaccine resistant. And I do agree that a lot of minority populations have and continue to be the most vaccine resistant. And I think that in order of how to counter that, again, I go back to this place of compassion, because yeah, of course, some folks are vaccine resistant. Because in the past, there is actually within their minority population a history of testing and subjugation that is real in terms of distrust. And so I think the biggest way that we can disseminate positive information in those communities is to get the influencers in those communities, church leaders, just people in the community to offer the information, but also to build strong relationships based in trust. And those relationships, I don't think, need to be revolving around convincing people that the coronavirus conspiracies that they believe are currently false. If instead we are focused on building a trusting relationship and a community, what that means is that when people have questions, they will go to that community, they will go to that trusted source for information first, right? So a lot of times what's happening here, I think, is we're trying to do this catch up of all these people that are currently believing or are falling victim to conspiracy theories. We kind of want to change their mind. But at the same time, and I think, I don't know if it's more important. That's my hyperbole, my superlatives again. But I do think it's super important that we start where we're at, right? And we start by creating communities where people will have sources that they know about to go to, and in order to prevent them from falling into that conspiracy belief kind of cycle or that misinformation. And then work on getting those other work on countering those people who might be a little bit more entrenched into conspiracy discourse. Then Jenny Jubilis. One of the challenges now is that people are seeing science evolve in real time. Oh, these, yes. Real-time papers are published without peer review, and sometimes the data changes. That's exactly right. How do we explain that to lay people as scientists to help counter that we are making up science? That's exactly right. And I referred to that at the very beginning a little bit in terms of process, right? I think that part of what we can do when we create these communities, when we're just retweeting things, when we're showing people what are valid sources, we can also be sharing information about what the scientific process looks like. What is the timeline? Because again, when people feel destabilized, when people feel like they don't know, which invariably they're not going to know, what they do is they're going to Google it and they're going to get these sources of disinformation because they don't have a place to go. But if we're already in their news feed, right? If we're already in their scrolling and they see, or they learn through a post that a practice has put up that talks about what is the difference between a peer-reviewed publication and these sources where non-peer-reviewed data is shared in order to potentially advance ideas, but that we take that information with a lot of caveats, right? That we take that information for what it is. It's not yet been verified, and this has. So I think that just forming those communities and creating those spaces can help that for sure. I see people popping back on, so I think I'll be quiet.
Yeah. Well, thank you so much, Stephanie, for a fascinating talk. And I think probably similar to your classes, students come up to you afterwards, and it's probably hard for you to get out of the building. I think if you were in our auditorium, you'd be trapped there for another hour and a half with questions. So thank you so much, and look forward to reading some of your discourse on this topic and other topics. Thank you.
That was great. So a question I had about countering things on social media, since there's so much being blitzed on social media. It's almost like a full-time occupation. And since some of the social media sort of gotten all this going, it almost seems like there's too much out there. And yet I understand ideally you would do that, but how you really can do that.
Yeah, I think, Carol, that's a great question. And I think that it just needs to start, right? Like the problem is that our technology, like we have not caught up. We have not kept up, right, with everything in terms of technology. And unfortunately, the manipulators have deployed technology absolutely in the service of their ends. And so we have bots, and we have, you know, all of these things that can, we have clickbait, we have all of these things that can multiply the impact of their stuff. Whereas people who are doing legitimate science, people who are trying to advance critical thinking, they're not using those same tools. And so I do think that initially it really just is about people who believe in science and people who believe in countering fake news simply start reposting. Like you could do something as simple, and I should probably take my own advice more often. I try to stay off social media for exactly the reasons you say, but to retweet the CDC's website just randomly, just to put it out there, to talk about the World Health Organization and to kind of put that out there, to retweet a paper that maybe describes the process of clinical trials and why they're oftentimes done sequentially, but why doing them concurrently isn't necessarily a bad thing, right? So there are certain things that we can do or say that would at least start to get that out there and balance the scales a little bit.
Hey, I'm so sorry to interrupt, but we are going to need this Zoom account in about 3 minutes for another meeting. So we're going to have to wrap up.
Okay, absolutely. No problem.
Yeah.
Thank you so much for having me. Thanks. I put my email in the chat. And so if people want to reach out, that's great. My slides, I'm going to forward to someone, and they do have some sources on them. And I am certainly willing to talk more about this with individual departments or people about exactly what you can do. And I'm also happy to deploy my students in helping create actual texts and resources that could be helpful for you. Yeah, they're so much better. They think of stuff, because I mean, I'm a child of the 80s, but they are creative and, you know, expansive in their thinking. So thank you.
Yep.
Thank you so much.